but it's around us everywhere. Everything from treatments like ginger and turmeric, right? I'm from the South Asian community. Ginger and turmeric solve all your problems. Why would you ever see a doctor? To being the mom of a 12-year-old who, every day has a new skincare routine that somebody on TikTok told her, this is the holy grail. So we see it. It's just that the difference or the highlights are when, lives are really at stake.
This is Sick Health with Kevin Ban, MD. Our show helps you navigate our confusing healthcare system so you can take control of your own health. Hi, everyone. I'm Kevin Ban, an emergency physician with over 25 years of clinical experience. Most recently, I was the chief medical officer at Walgreens, where I led the pandemic response.
Hello, everyone. I'm Alex Wallace, a longtime journalist. I was an executive at NBC News and most recently at Yahoo. Today on the show, we have a great case for you. It's medical misinformation and disinformation with a really wonderful guest.
Today's episode is brought to you by C2 Sense. C2 Sense is working hard to bring lab-quality diagnostic equipment into the home and priced for everyone. Learn more at haloreader.com. It is my pleasure to introduce GEETA NAYYAR to the show. GEETA, welcome. Great to have you here. You and I met during the pandemic, if I recall correctly. It was the early days of 20, just after we were trying to launch testing. At the time, you were the chief medical officer at Salesforce. Do I have that right? Is that the first time we got connected?
You do. And you were the chief medical officer of Walgreens, saving lives all over the country. So it's great to be with you. Thanks, Kevin.
Well, it's great to have you here. I'm going to do a little bit of background on you. I know that you went to the University of Miami. You got your undergrad degree there, but also your medical degree, and then up to DC, where at GW, George Washington University, you studied medicine, internal medicine, and you became a rheumatologist. Not only, if I got this right, too, you got your MBA. So you've always been one of these people who's been able to thread the needle between clinical medicine and the commercial side of medicine and technology. So you're kind of getting through all of that. But I'm going to back us up and just say, I know you were raised by doctors. Why did you decide to become a doctor?
Well, in spite of being raised by two doctors, I will say that I became a doctor. But really why I became a rheumatologist, a lot of people don't actually know what a rheumatologist is, but it's a specialist in autoimmune diseases, specific types of arthritis. My mom actually has a really rare autoimmune disease, so it's a big part of my journey in medicine. And I think most people in medicine, right, Kevin, I mean, you've seen this, most people in medicine have a personal story. I think you need that inspiration to get through about 30 plus some years of training. So that's the key. That's what I tell my daughter. You better want it.
Okay, let's get into it. First, I just want to start by asking you the difference between misinformation and disinformation.
Well, it's a great question because a lot of people don't actually know the difference. So misinformation is just getting the facts wrong, right? You thought it was an apple, it was really an orange. But disinformation is a lot more scary because that is actually the intentional manipulation of information to sway or have some benefit to people or the masses, like a political election, some sort of religious motive, or of course financial. We see this a lot with people selling anything from supplements to skincare on social media, et cetera.
How big of a problem is it?
Well, mis and disinformation are not new. What is new is the speed at which mis and disinformation is traveling, largely because of technology, right? I'm a technology doc, and so I've been studying this. And really, mis and disinformation has been around since the Black Plague. We've had it long before we've even had vaccines, for that matter. But what has happened with social media, artificial intelligence, we're also living in an era where everyone has a computer in their hand or on their wrist. And so mis and disinformation are actually spreading 6 times faster than the facts. So whatever problems we think we have with mis and disinformation now, they're only going to be amplified as we become a more tech-forward society.
Now, I'm going to bring this up like right away, and you guys can see that.
I did not pay Dr. Bonbon for that. Thank you, Kevin.
It's a great book, GEETA, and I'll tell you, you gave this book to me back in the fall, and I read it, and a lot of what you talked about, and you used a lot of narrative, a lot of stories from your own clinical practice, and I found that really, really helpful because it felt very real to me. It was experience that you had lived and you had seen. But what motivated it? I know you're very interested in misinformation, trying to clear up even worse disinformation. What motivated you to write the book?
Really what inspired the book, I talk a little bit about it in chapter 1. It really reminded me so much of the HIV/AIDS epidemic. I mean, anyone who lived through that, I know all of us on this call have. When I was sitting here in my home office during COVID, I just remember sitting here saying, man, this feels like deja vu. Like we've been here before. We've been at this epic crisis where information was getting manipulated, science was getting politicized, religion was somehow involved, and people who got the information wrong died, right? Died. And I was a young physician at GW at the time when the HIV/AIDS epidemic was going on. And literally every third patient you saw literally walked in dead. I mean, you could just tell this was an AIDS patient and they had like 2 days, maybe 1 week. And so it was a feeling and an emotion and a time you can never forget, very reminiscent of the pandemic. And I remember as a doctor in training at the time being told by, our professors, our attendings, et cetera, that we were going to be better doctors for having lived through the HIV/AIDS crisis. We were going to understand public health. We were going to understand so much about science that you cannot get from a textbook. And what happened during COVID, we told our medical students, I still see patients at the University of Miami, and that's exactly what they told them. I think we have a visitor, like a super.
Yes, my dog Atticus. All of a sudden, I'm talking and I'm like, what? Or I'm listening. I'm really fascinated by this, and I feel this little nose at my arm. So yes, this is my dog Atticus. And at some point, I actually am really fascinated by what you're saying. I'm going to stand up and close the door. Hello, Atticus. He's a COVID shelter dog. I've never had a dog, and I'm completely in love with him.
Oh my gosh! Well, hey, Atticus, he can stay. It's fine with me.
No, he's going to stay. He likes to learn.
GEETA, I remember the same thing about HIV when I started my career. This is the late 80s, early 90s. I started medical school in 92. And I remember all of the misinformation that surrounded HIV and AIDS. It was alarming what people thought about it. Until now, quite honestly, I really hadn't thought about it as my first experience with medical misinformation. And it's fascinating to know that, quite honestly, all of this goes back thousands of years, right? And this is nothing new, but it's got that last component or that other component of social media, which is almost like, intensifying it or lighting it on fire. It's an accelerant. What are the things nowadays that concern you?
Well, I think the bigger thing is really this lack of trust in science, right? This idea that if you are a doctor or you come from the healthcare or science arena, you must be wrong, right? So more than anything, it's an erosion, I think, of the trust that we have lost in science. But secondly, we're talking about HIV/AIDS and the pandemic, that those are highlights of just the stakes being really high in mis and disinformation. But it's around us everywhere. Everything from treatments like ginger and turmeric, right? I'm from the South Asian community. Ginger and turmeric solve all your problems. Why would you ever see a doctor, right? To being the mom of a 12-year-old who, every day has a new skincare routine that somebody on TikTok told her, this is the holy grail. So we see it. It's just that the difference or the highlights are when, lives are really at stake, but lives are always at stake, right? When we talk about diabetes, we're talking about cancer, fertility is rampant with so much sort of myths and mystification, how to have a boy, how to have a girl. There's smack talk everywhere, Kevin. It doesn't matter what specialty it is or what it is, but it's really, for me, I think the biggest thing that we've lost is the trust. And when the stakes are high for certain diseases in particular, you really can lose your life. So it's not a joke, right? It's not something to be sort of dismissed the way we have for so long.
And I think it's interesting. In your book, you say that the WHO called COVID-19 an infodemic. So I think that also speaks to kind of probably what changed between AIDS and COVID was just the ability for everyone to get misinformation.
That's right. I also have to tell you, one of the things I realized during the pandemic in particular is just the lack of health literacy we have. The fact that the everyday person just doesn't know the difference between a virus and a bacteria. It doesn't matter if we have a pandemic or not. There are basic things you should know about the human body for your own livelihood, your family's livelihood. And I think that's one of the other things we have to take away from this. And I feel the same way, by the way, about financial literacy, right? There are just some certain basic life skills that we all should have or provide in our communities, and health should absolutely be at the top of that.
I feel like you're teeing this up, GEETA, to a certain extent, because it's the reason why Alex and I really talked about doing this. My experience was that people need good, credible information from people that they trust. And we thought we could bring that. And our topics tend to focus on a broken healthcare system, more importantly, what you can do about it. Even more important, how to stay healthy, and how to keep your family doing well. And then we're going to get into myth busting, which is kind of cool. I know in your book you touch on myth busting, but that's what we're trying to do here, is to bring really credible information. Do you see that happening? Like, we always talk about the negative, but do you see that more credible people are beginning to get into the space and put out information that's reliable?
Well, first of all, that's why I'm thrilled that you guys are doing it. I'm thrilled to be a part of it. I think we need more of it, because just as much as the folks out there, the misfits out there, are spreading disinformation, healthcare leaders, like all of us, have to lean in and actually use the same technology for good, right? Because why not spread the facts 10 times faster if the dis and misinformation are going 6 times faster? We're generally a smart group, the science community, right? But we have to get the headline. So I think what you're doing is terrific. And there are pockets, right? If you look at the Cleveland Clinic, the Mayo Clinic, I talk a little bit about this in the book. They very much did that. They said, look, we are going to put marketing behind the science. We are going to partner with YouTube, just like you guys, right? We are going to get real smart about TikTok, because they recognize, one, that they had a trust issue in their community, but they also recognize that's where consumers are going. And the consumer of today is thirsty for healthcare information, hungry for how to do it right, how to do it better, right? And that's why so much of what you see now is the success of anyone selling anything, because the consumer is so hungry and thirsty. They're not thinking twice about buying that supplement for $10.99 that cures baldness, when they could, in fact, go see their doctor, see what they can actually do to take care of themselves and not be extorted out of $10, right?
So let me ask you a question about that. What should we do? I know you've got a ton of really useful information in the book. What can we do as health consumers? How do we better educate ourselves? What are things that we should be looking, or that the audience should be looking out for?
So there's a couple of things. I think the first thing that I always tell any consumer is, look, you got to have basic health literacy. You got to know some just basic things about your body. Your doctor can only do so much, but go out there, read some basic science books, right? Number 2, if you are looking for information, check the source. So if you see something on TikTok, or a friend has passed you something on WhatsApp, check the source. And then check multiple sources. Are they all saying the same thing, or is there a disconnect, right? And then check sources like the CDC, like the American Academy of Pediatrics for a lot of moms out there. Check actual credible medical science sources. And 3, look at the language. When they use language that I call it the spidey sense, when they're using language that just doesn't sound quite right, like, want to be younger forever, lost your hair, lost your energy, right? These are not terms that a doctor would generally speak in, right? So being mindful of marketing language, and anytime someone is telling you to buy something, whether it's $5.99, $20.99, whatever it might be, that's a good red flag of, hey, this doesn't sound quite right. And lastly, the best thing you can do is to have a doctor when you're not sick. I'm going to say it one more time. Get yourself a doctor. Get yourself a pediatrician. Don't wait to end up in the emergency room. And one of the best conversations you can have, even on a virtual visit, right? You don't even have to go in, skip work, sit in the waiting room. Set up a virtual visit and just ask these questions like, hey, doc, I'm turning 50. What are some things I need to know? Where should I be reading? I mean, I frequently tell my patients where I read. I'm asked what I read. But then I say, look, I want you to know about your lupus. I want you to know about your rheumatoid arthritis. We can have better conversations and make better decisions together. But I don't want you going anywhere and everywhere. I want you going to the Lupus Foundation. The Arthritis Foundation has great information. Their entire mission is to serve patients. So having the conversation with your doctor starts with having a doctor, Alex, right? And that's one of the biggest issues we have in healthcare right now.
You're singing Kevin's song, literally, Kevin.
I know, he's like salivating.
Every question, the answer is get a doctor. Because he's right. You need to begin all of these conversations. You need to have a doctor. And there are a lot of people, we've talked about access. There are areas where it's hard to get a primary care physician, but you are completely right. It all starts with having a doctor. So Kevin, I am now convinced. It took Dr. G to convince me. That's not true. I thought you were right to begin with, but
I want to get some clarification here, though, Dr. G. You said, well, I can't be young and healthy forever. I mean, let's get back to that point. That's not a thing.
Listen, Dr. Bonbon, if you can tell me the secret, because
I
there's
am
just
with you.
natural things that happen.
It is 100% about aging gracefully, but it's totally doable. Hey, let me ask you, I'm going to flip it. What's the other side of this thing? You're talking about patients. What's the impact been on doctors, right? Like, what about our colleagues? They are there churning and burning, by the way, working really, really hard and trying to keep up in a system that is difficult, quite honestly, for them. So what's it like for them on the misinformation side?
Well, it's a tough time to be a doctor. First of all, 1 in 5 healthcare professionals has left the profession since 2020. So it's a lot of people. A lot of people, which has left us with a lot of docs. So the last folks standing are burnt out. We are living in a system where 92% of Americans still trust their doctor, by the way, but 52% of Americans don't trust the system that their doctors are operating in. Right? And that says volumes, because that's exactly how physicians feel. They feel like they have to navigate around the system to actually do what's right by the patient. And there's a lot of reasons for that. Insurance reimbursements not being quite right, technology slowing docs down, an environment where you do have a shortage and you're sort of morally feeling responsible to take on more because there isn't another specialist like you in the area. But I think the take-home message is that we have to, again, instill the trust back between doctors and patients. And mis and disinformation takes that away. Because what happens is patients come in. This happened during the pandemic. I'm sure it happened to you, Kevin, if you saw patients then. People coming in saying, hey, doc, like, I'm not taking the vaccine. Or in my case, in rheumatology, we give a lot of really strong drugs. And so patients will go online after getting a new diagnosis, and then I can't convince them to go on any therapy besides some kind of holistic therapy, because they get very wrapped around the side effects. It becomes very difficult to change a patient's mind once it's made up. So it really is contributing to the burnout issue, in that physicians feel like, well, gosh, I'm the expert. You came here for some expert advice, but you're actually not interested in it, right? So it's become a contributor to the divide. On the flip side, if we can have that conversation sooner around how do we partner, what can we read? How do we answer questions? How do we build the trust? That becomes much more interesting. And I think we see that with some of the TikTok influencers, Dr. Mike, Dr. Austin Chang, Dr. Joel. I mean, there are some physicians who've done the opposite and have taken it in their hands and said, follow me on TikTok. Let's have a conversation on social media. And then you can also make an appointment to see me, right? Keeping in mind virtual visits is, again, very much something that's here to stay in healthcare, and we should be taking more advantage of it no matter where we are in the country.
I was just thinking, as you said, when you get an Amazon, you're going to buy a product and you look at all the reviews and you look at, there's 99% of them are good. And then unfortunately, this says something about me. I go read the one that's bad. And then you're like, I can't buy the product. But actually a doctor, it's like all medical drugs. 99% of the people, that's an exaggeration, but a large percentage it's very healthy for. And they're a very, very small percentage it's not. And your doctor is your filter and making that decision for you. It is most likely this will be good for you. But if you're out on the internet reading every single instance of anyone who ever took this drug, you might come upon the one person it really didn't work for.
That's exactly right. And that's why we go to doctors, right? That's also why we go to lawyers, we go to accountants. It's a service professional. Ultimately, healthcare is a services business, right? And we all have unique health situations, just like we might have unique financial or legal situations. And that's why you want to go to someone who is customizing a healthcare decision or treatment plan to your kidney function, your liver function, right? These are conversations Kevin, we have these every day in the examining room, right? In rheumatology, for example, we'll go through this and I'll say, look, we're going to try first-line therapy, if it's Humira, Enbrel, whatever it might be, but then we're going to monitor your kidney function. We're going to monitor your liver function. And if something changes, we'll pivot, right? But there are general guidelines, absolutely. I mean, every body is different. Every human body is different and reacts differently and has allergies and family history and genetic components. So that is the whole point of the doctor-patient relationship when done correctly.
Yeah, that's always been my take on it too, is like, it's an iterative process, right? It's not like one and done and it's over. I think of technology, and I worked at a tech company, as you know, as well. I was at Athena Health, as sort of something that helps facilitate care. It's something that helps at times scale care, but it doesn't replace the relationship you have with your doctor. There's no bot There's no AI, and I want to get into AI in a second. There's no substitute for having another person who's on this journey with you, right? And sometimes the treatment will go famously and it's wonderful, and then other times it won't, and you need to work together. And that doesn't mean that it was a wrong decision. It doesn't mean that another path should even have been taken. It's just that it didn't turn out for you. So now what's next? And that requires partnership. That requires fellowship. That requires trust, among other things. I mentioned the AI word, and it would be irresponsible of me if I didn't get into AI. How do you think about it?
Well, first of all, I get asked the same question a lot. I'm also sure people ask you about that Pulp Fiction poster behind you a lot as well. So we'll have to get into that.
Thank you. That's a must.
There's no time like the present. There is no time like the present. All right, couple of things. Number one, this is spinal tap. Okay, if you do not know this, actually don't admit you don't know this, because I'd have a hard time going forward with this whole
No, it's kind
interview.
of cut off, Kevin. You can't. You can see just the corner.
And a beard.
Oh, okay. I would.
Chong, actually.
Right, I don't know if you're supposed to do this, but can you see it now?
Now you can see it.
Okay. This is Spinal Tap. My favorite movie in college. Am I back to where I'm supposed to be? I don't know. I can't see myself.
Yes.
Pulp Fiction.
You're a lot older than me. I don't know what the heck Spinal Tap is. To me, that's like the thing we do in the hospital when we're doing.
I know. No, okay. Promise
analysis.
me this. And actually, everyone, the community, the sick health community, promise me you will go and watch This is Spinal Tap. It isn't a rockumentary. It's a documentary on rock and roll. It's a very funny.
You're also given a total pass.
Having his middle-age crisis right here live on this show. I'm just.
I was going to say, I'm
call it what it is.
I'm coming to grips with myself. But I will just say quickly about Pulp Fiction. You may appreciate it. You know, in those moments in the hospital where it's very difficult, and the only thing that's going to relieve how you're feeling about things and get you through is humor, we would use a lot of quotes from Pulp Fiction. And there are many people. Aww. And so that's why it's actually so important to me. And we have a bunch of posters in the room. Each of my kids have a poster. My wife has a poster. We got Casablanca down there. But you can't get away from the AI question.
So on AI, look, I think from a technology, I'm a doctor, I'm a technologist. I think the opportunities with AI are limitless. I mean, if you think about the things we could do, when we think about diagnostics, therapeutics, combating mis and disinformation, I mean, it's unbelievable. But what you said is really important, which is people come to the doctor because they're in some kind of crisis, right? Healthcare is, at the end of the day, a human business, right? This is the business of humanity. And it is generally a scary, vulnerable time. Whether you have to have surgery, whether you're having a baby, whether you have a new diagnosis of diabetes, lupus, whatever it might be, it's generally a life-changing, health-changing event of some kind. And fundamentally, when we measure patient engagement, we measure what patients are looking for. There are very limited studies on this, but the thing that patients measure when they feel like their doctor's actually listening to them and is someone therefore they can trust is they look for their eyeballs. There was a study in JAMA, I can't remember what year, but they literally call it eye time. And patients were surveyed after they saw the doc. And they said, do you think that doctor is like a good doctor, right? You were talking about Yelp reviews before. Actually, the thing that patients look for is, did you look at me and nod when I said something? Or when I was in pain, did you look like you were empathetic, right? I mean, it kind of makes sense, right? They didn't actually look to see, did you have an AI robot? Did you have an EHR? Were you dressed nicely? It's really interesting. And that just speaks volumes about the humanity factor. And my biggest concern with AI is really is that we maintain the human factor. We actually, in fact, don't aim at replacing doctors and nurses. I think that's the wrong problem to solve. But could we make the decision-making easier for doctors and nurses at the bedside? Could they get information faster? Could they get it better? Could it be more personalized to the patient? Absolutely. I think that there's absolutely ways to improve medicine on the back end. I also think about documentation, all the prior auth. We're getting really nerdy here. I'm not sure the audience understands that, but half the reason patients wait in the waiting room is because of those reasons. It's the paperwork. And so if AI can handle some of that, well, gosh, I don't want my patients waiting in the waiting room. And I'd love to actually look them in the eye and not be worried about documenting at the same time.
Let me go deeper into that for you for a second, because when I was at Athena, we looked at that very thing that you're talking about, documentation time, right? And we started to call it pajama time because we saw that doctors were getting up very early in the morning and they were doing documentation in their pajamas. And then they would go to work, and around lunchtime, they'd be doing some documentation because everything was electronic, so we could see when they were doing things. And then they would see patients in the afternoon, do some documentation, and then they go radio silent, like 5, 6 o'clock in the evening until 9 o'clock in the evening. And you can imagine they might be going to their kids' sports or doing whatever they're doing, dinner, that type of thing. And then what are they doing again? Pajama time. They're back documenting. And that is a really good use of AI, right? Like, I don't believe that we replace the doctor, but what we do is free the doctor up from that type of work. And there are really cool technologies that can listen to a conversation between you and your physician and take all of that information and put it into the electronic health record exactly where it's supposed to be. And so that is really, really interesting stuff. And this allows the doctor to do what you're saying, GEETA, which is have some eye contact, like connect with me, and that's quite honestly exactly what doctors want to do. So I'm with you on this. Get rid of the administrivia, all of the bureaucracy, all the phone calls to the insurance companies. Let technology take care of that stuff.
That's exactly right. And I think the other piece to it is really understanding that we are living in a time of burnout. And, it takes 30 some years to make a physician. And so we're not going to close this gap anytime soon, right? It's going to take generations. And the reality is we're never going to have every specialty in rural America that we'd like to have. So if technology can make the existing doctors that we have that much better or able to scale in a way that we've never had before, I'm all for it. Right? But again, it has to be with the human factor in mind. It has to be with the patient also feeling okay to have that conversation recorded or okay to have that technology listening in and dictating. So there's still many, many unknowns, right? There's still many things that we're learning about artificial intelligence. And so I do think we have to be mindful of the crawl, walk, run as we learn, about hallucinations and the things that the technology can do that we may not quite understand what exactly it is doing. And so just being mindful that it is a complement to the physician and the care team in charge, but not the solo pilot. We're not ready to do the autopilot in healthcare. And I don't actually think we will, at least in our generation.
C2Sense is doing important work with its Halo platform, applying technological advances in chemistry, machine vision, and material science to provide both patients and providers with laboratory-level accuracy at low cost when they need it. The pandemic reinforced the importance of being able to test in the privacy of your own home. C2Sense's goal is to use their patented technology to ensure the same quality of testing you would find in your doctor's office in the comfort of your own home. So if you're suffering from upper respiratory symptoms like cough, sore throat, nasal congestion, or a headache, keep your eyes out for C2Sense as they're developing tests targeting upper respiratory conditions such as COVID and flu. If you want to learn more, see what they're up to at haloreader.com. I can't help but think about AI and social media. And are those like two cruise liners headed at one another? What do you think about that? Is this sort of adding fuel to the fire?
So, I worry about it, right? And this is also why I wrote the book, because, for the first time during the pandemic, the Surgeon General actually put a Surgeon General's warning on mis and disinformation out into the world, saying, hey, world, pay attention. And we haven't really, right? Because now we're all so excited about AI. And that's really the question again with AI. It's all how we use it. It's a fantastic technology if used for good, but if used for evil, it's pretty fantastic at spreading evil. And so that's what we have to be mindful of, because in the healthcare space, and we've seen it in the political space, right? We've seen social media bring down regimes. We've seen it influence elections. And the mis and disinformation part of that is right there with you. And in healthcare, again, we're talking about people's lives. So I think we can use it for good if healthcare takes control and says, hey, we've got to, be strategic. We have to make this part of our strategy. This is how we build our brand. This is how we attract patients and build trust. But on the flip side, if we stay largely quiet, ignore the issue, which the industry has done for the most part, other misfits out there are profiting off our patients, and AI will allow them to do it much better.
Oh, I agree with that 100%. We need to have a strong voice here. We need all providers sort of voicing their concern about AI, how good it can be, But that collision between social media and AI is concerning. Social media, we did not regulate it, right? And I think now we're looking back and saying, maybe there should have been some guardrails. What about policy as it pertains to AI in healthcare?
So I think very similar. And that's a great example because, again, everyone seems to be so excited. Every other word that we talk about is AI without even knowing exactly what it is in many cases. We don't have to look that far because we had the same excitement about the internet, about social media, about electronic health records in healthcare. And so we have a lot to learn from those lessons, which is social media is a great example, largely unregulated to this day, largely regulated by the social media companies themselves. We cannot make the same mistake with AI, right? And now we have all this data on social media and how it's lobotomizing our children. It's costing people their lives. It's influencing elections. And AI is just going to be the next chapter of that unless we actually, as a healthcare community, and I would actually say doctors, nurses, patients, because you talk to some families who lost the lives of their loved ones during COVID, couldn't convince them to get vaccinated, couldn't convince them what was science versus fiction. And they have very strong opinions, right? They've lived it. And so I think we need to, from an advocacy standpoint, really make sure that the right stakeholders, particularly in healthcare, are weighing in, making sure policymakers understand the stakes and offering solutions that still allow for innovation, right? So not saying let's clamp this thing down, but saying let's be ethical. And in healthcare, if we haven't gotten the message in a post-pandemic world that this needs to happen, we're never going to get the message. This is the time. It's one of the most historic times to be in healthcare. So why would we not be louder and stronger and more united?
I want to ask about response to your book, which, by the way, is amazing. It's called Dead Wrong, Diagnosing and Treating Healthcare's Misinformation Illness. I love that you called it illness. How has the response been, particularly from doctors? How have doctors responded to this?
The most common thing that I've heard from the healthcare community is thank you. Thank you for raising this issue. It's something we've always ignored. We always knew it was there. It was always there, just like that, very particular smell in the hospital. It smells like, Lysol and very sterile, but no one ever comments on it, right? That's really what most of the healthcare community has said, is that this was so obvious and yet so invisible. And so highlighting it has been really important. And I think particularly on the health equity side, I've also gotten a lot of reaction of, this is really the issue of the underserved. The Black and brown communities are most susceptible to this because they don't trust science and they don't trust doctors and hospitals and they don't trust them for really good reasons. So they fall victim to a lot of this much faster and quicker. And so we have sort of recognized that this is actually a health equity issue as well.
I really appreciate you adding that last point. Okay, Dr. G, you are amazing. How can our audience, they need to get the book, but what else can they do? How can they follow you?
Well, thank you for that. I have a website. It's hard because it's my name, but it's www.drgeethanayar.com. But I'm also on Instagram, Twitter, LinkedIn as Dr. G, and I welcome the conversation. Thank you so much for the invitation and for bringing the topic to light as well.
At the end of every show, I do my journalist job and I try and do kind of a summary of the things I heard. And usually I forget one or two things. So you and Kevin will keep me honest. I love you flagging us that AIDS was well before COVID in being a disease around misinformation and disinformation flourished. 2, saying correctly that we all need doctors and that Kevin, as he always says, is completely right. 3, informing yourself. I love the 3 things you said. When you see information as a consumer, check the source. Reference the source. Is it Mayo? Is it CDC? And then are they selling you something? Because that's a motive. That's someone who's got a motive besides just informing you. I love actually how you framed AI. AI should be able to get the doctors have less pajama time, as Kevin called it, and more eyeball time. And I love that promise. I think there are lots of things about AI that are potential downsides, and you mentioned them. And just the issue of health equity, which I think is a very important one, which you talk about in your book. What did I miss, Dr. G?
Well, first of all, thanks for listening to me. You captured that beautifully. Now I know why you have so many Emmys. The only other one I would say, and we often don't think about it, is when you do see a piece of information right? And you haven't done all the things you just said, check the source, made sure it actually makes sense, no one's selling you anything, don't pass it on, because then you are actually promoting mis and disinformation, right? If you don't know, kind of like telling rumors, like if you don't know if it's true, if it's something that will help someone, keep it to yourself. Keep it to yourself. And I don't think we think about that one as much.
I think that is great advice. We're building a tradition of sharing beauty at the end of the show. And I think that Kevin and Dr. G are going to do it together today.
We are lined up on this thing. And Alex, I think you're actually warming to this whole concept.
Don't get carried away.
Sharing beauty. All right, GEETA, I talked to you about this briefly. It's a family tradition. It's become one. We've been doing it for over 12 years where we kind of shout out something beautiful. And so I asked if you would do that. And immediately you came up with an idea. So share that with us. And then we'll be sure to put it into the show notes.
You bet. So one of the videos, whenever I see them pop up here and there on Instagram or social, is always of these little kids in India, typically on the street or at a family gathering, and they are decked out. They're like less than 5 years old, but decked out top to bottom like it's a wedding, and just dancing their bottoms off in this way that makes them look like they're like 50 or 60-year-old sisters hanging out for the first time in years. And it just makes me giggle. It makes me giggle, and I think you'll enjoy it.
And then this is where we close. And this is where I thank all of you for being a part of the community. And I also want to thank Bat-Sheva Guez for producing the show. And to all of you, we're looking forward to seeing you next time. Be well. This show's content represents the personal opinions of Alex Wallace and me. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and does not create a physician-patient relationship with me. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or your general health.